Hi, I'm Karen, and this is the Mental Health Hope You're Not Alone podcast. This space is all about breaking the stigma of mental health, where we'll share personal stories, helpful online resources, and meaningful insights, all with one goal in mind, to remind you that you are not alone in your mental health journey. Hello, Hope Souls, and welcome back to the Mental Health Hope You're Not Alone podcast. And I'm your host, Karen. And I apologize immediately for how I sound. I am sick, but I wanted to get this podcast done because I think today's episode is going to be fantastic. We are going to be talking about how to find a therapist and what types of therapists there are. So let me give you a little bit of a background. So I see a therapist every 2 weeks. And recently I actually had some really high anxiety. And I decided to go to my primary doctor to up my anxiety medication. And through that conversation, she said, maybe you need to go to a psychiatrist to get that medication monitored and maybe change up what I've been taking. And so I've been doing that, and I then discussed that with my therapist. And she said that after talking with my psychiatrist about the medication, I talked about it with my therapist, and she said maybe there are agreed with the psychiatrist, we'll say that. He mentioned other types of therapy, and I talked about it with my counselor, and she said yes, there are other options beyond what she and I have been doing. She's one that talks about, or we work together to find ways to get over my anxiety, and basically it puts me in a place where I have to go and we work through different scenarios and try to get me into those scenarios so that I have better coping strategies with the scenarios that cause me anxiety. It's very much immersive is what I call it, to where I put myself in the situations that give me anxiety, and then I work through that anxiety. And like we mentioned in the last episode, I then can close the loop and get back to safety. Let's do a quick recap on that. The last episode, we talked about the anxiety loop, where you start out where you feel safe, you see a threat, you conquer that threat, and you work your way back to feeling safe. And what happens with anxiety is you start out safe, you see a threat, you avoid that threat, which leads to anxiety, and you don't connect the anxiety loop. You don't get back to safety. And so by immersing myself into these situations, the hope is to close the anxiety loop. So anyway, that's where I'm at now. I'm actually in the process of trying to find a therapist beyond the one that I currently have. And I thought, what better way than to discuss those types of therapies and learn more about them, see what would work best for me, and then discuss it with you. So let's talk about the different types of therapies. And I will say that there is so much more to therapy than I ever imagined, that how many types of therapies there are. So we're going to talk about the different types of therapies that we have, and then we're going to talk about that in like more specifics. And then I also found, I would say, obscure ones that may not be as well known. So we'll talk about that. Let's get started. So there's different types of therapy, and this article here talks about talk therapists. It has it in quotes, talk therapists. And so that's a licensed clinical social worker, or LCSW. So you might see those initials at the end of their name. There's a licensed professional counselor, LPC. Again, you might see those initials at the end of their name. And a licensed mental health counselor, LMHC. Licensed marriage and family therapist, LMFT. Clinical and counseling psychologists, and then there's psychiatrists. So for those of you who don't know, so psychiatrists can prescribe medicine, whereas a psychologist can't. And it's one where you typically go in and you talk with them about whatever situation it is. And so with my psychiatrist, I've only had 2 meetings with him. The first was, I don't know, I think it was roughly an hour, where we talked about my history and what medications I've been on and what, if they've helped, if at all. If not, then what I can maybe do instead of that. And so what he ended up doing was keeping one of my medications that I use for anxiety, which has helped me quite a lot, is propranolol, if you want to know. And then the other one, and unfortunately, I'm sorry, I cannot think of the name. No, I can't think of the name. Zoloft, maybe? Don't quote me on that. There's another one that I take, and he doubled that, so I take both of those at night. And then this last meeting, he decided that I needed to have a supplement to that current medication, and now I will be taking Wellbutrin to help with putting all the medications together. The last meeting we had was only 15 minutes, and it was just let's talk about your medication, what's working, what's not working, let's prescribe something else as a supplement, and then the meeting was over. So nothing really with respect to helping the anxiety beyond the medication that he's prescribing. So let's talk about the different types of therapy. And in this specific article, it talks about the talk therapist, which means you're basically going in and talking with whatever type of therapist you have. And I keep saying talking because this article also talks about doing, and it puts that in quotes. And that's more along the lines of like physical therapy, things that your body is involved versus talking to a therapist. But so anyway, a licensed clinical social worker, LCSW, is a psychotherapy and clinical social work addressing mental health challenges within broader environmental contexts. Licensed professional counselor is a psychotherapy and clinical mental health counseling. Treats a variety of emotional and psychological issues. A licensed mental health counselor, LMHC, is the psychotherapy and clinical mental health counseling, diagnoses and treat mental health disorders. A school counselor, which you'll have one at each school, typically. And then another one is a licensed marriage and family therapist, LMFT. Sounds like a band, LMFAO. Sorry. Anyway, therapy related to relationship dynamics, provides psychotherapy to individuals, couples, spouses, and families. I did go to a marriage counselor years ago with my ex-husband, and she was phenomenal. I loved talking with her because she gave me the kind of therapy that you talk about your history and then you learn why you do certain things. And I'm interested in finding that again, not necessarily a marriage counselor, but somebody that I can talk to about my history and find out why I do the things that I do. Because I think ultimately that's the bottom line, is if you know why you do things, then you can consciously not do them. And that's why I really enjoyed the last episode, because it was really eye-opening to me how anxiety works and how I had been avoiding things. And I didn't know that. It was something that I learned after talking with my career coach, of all things. It was actually a combination between my career coach and my counselor. My counselor is the one that actually said something about avoidance and gave it a name, but I talked about it with my career coach, and he was able to put 2 and 2 together about various things that I had been doing. And it was a great episode. So I will link it so you can go watch it. It's really good. So anyway, and then there's a psychiatrist, which is diagnosing and prescribing, and then a clinical counseling psychologist is diagnosing and counseling. So just a really quick definition as to what those are. So let's move on. So let's talk about ways to find a therapist. And this is an article from NPR. which gives you a step-by-step process and how to find a counselor, psychiatrist, therapist in general. So the article is a step-by-step guide to finding a therapist. So we're going to read some of this. Number 1, figure out what you need help with. For me, it's anxiety, depression, PTSD, and agoraphobia. And so knowing that, then I can hopefully narrow down what I'm looking for. The next step here says to assess your financial resources, know your coverage and options and your budget to decide where to look for a therapist. And I think this is really important because my current therapist was originally under my insurance. And unfortunately, she is not now because I switched insurances at the end of last year. And so she's not now. But, so I pay almost out of pocket. I do get a little bit of a discount, but I do pay it out of pocket. So that got to be expensive, or is expensive, because I see her twice a week. And then now I'm seeing a psychiatrist who thankfully is under my insurance, so no problem with that. It's really cheap, $20, which is nice. When you're assessing your situation, and mental health is extremely important, you may have to give up something somewhere else, which can be difficult. For me, I didn't do that. I just tried to figure out a way to make it to where I could pay my therapist. So anyway, you can also self-pay, like I said, which is what I'm doing. So it's about $100 per session for her. There are free and low-cost therapies. Some county mental health departments and nonprofit organizations like Mental Health America provide free and low-cost therapy for people on Medicaid, people who receive Social Security for disability, and those without insurance. That's what's called the community mental health, as opposed to traditional outpatient or inpatient treatment. So that's good that, that's available. And I wouldn't know how well known that is. I didn't know about it, so that's great. And then step 3, do some searching and understand the credentials. So the directory at psychologytoday.com and goodtherapy.org are useful for learning about therapists in your area and targeting your search. Many share bios, photos of short videos about themselves. You can search by issue, like depression or addiction, marriage counseling, or by type of therapy. And then you can also search by age, gender, ethnicity, language, sexuality, and insurance. That's good, because I will say I was used to my old insurance because I'd had it for several years, and switching to a new insurance, it's been hard, not necessarily finding a therapist, but it's been hard to find doctors and other types of practices like dentists. I don't think my insurance covers my dentist at all. I have an appointment coming up. Okay, so then it says if you have a sense of what issues or diagnoses you want to address, you can then hone your search to searching for types of modality of therapy. And that actually was something that my current therapist talked about, because it's interesting to find out how many types of therapies there are. I was shocked to find that out. And so one of the things is, we'll talk more about this, but cognitive behavioral therapy, CBT, which is actually something that I didn't realize I was going through with my current therapist. But I found out in talking with her because my psychiatrist recommended cognitive behavioral therapy. And then when I talked about it with my therapist, she was like, yeah, that's what I basically do. I didn't know that. So find out what type of therapist you need and make sure you understand what they can provide. Because I did not. Next step here is to assess if they if they're a fit for you personally and culturally. And I would agree with this. It's hard sometimes to find one that fits well with you. And I say that because this is my third therapist that I have been to. And the reason for the change was because I moved. And so I had to get a new one. But where I used to live, I actually had 2 therapists there. And the first one was completely worthless. I went to see her a few times. She didn't know who I was. She didn't remember the stories that I told her. So basically, the counseling was very much a repetitive conversation, and it wasn't really worth my time. And she did provide some diagnoses and some medication, but beyond that, talking with her was just not worthwhile. And so there's that aspect. And then the one I had after her, and thankfully she retired. That was a good thing. Thankfully she retired. And so because of that, I had to find a new therapist. And the next one was fantastic. She was really good. And unfortunately, I ended up moving and I had to end my therapy with her, I was really sad about. I really enjoyed having her as my therapist. And then currently in my current area, I've been going to my current therapist for, I don't know, let's say 9 months now. And I really dig her. She's very open-minded and I can feel comfortable saying anything to her. I was very honest with her, which I think you have to be. If you're going to a therapist, you have to be open and honest. And I was very honest with her about my history and everything that I have done up until that point, and she's followed me through that since then, and I really appreciate that. I dig her a lot. She's great. The problem is me. She gives me assignments, and then I fail those assignments because the depression and anxiety at times, it's just so overwhelming. For example, she wanted me to go pick up my car this past week, and number one, I'm sick, and so I didn't feel well enough to go do that. But she's trying to get me to go do it because I have such huge anxiety about leaving the house, and so I appreciate that aspect of it. Anyway, so let's move on. And the next step is just to reach out and be persistent. So make sure that you get an appointment with them and then have follow-up appointments. Like my counselor, we meet every 2 weeks and we make the next appointment at the end of the session. So it's a constant rolling of appointments that we have. And then interview a prospective therapist. I do agree with this. So it says there's a limit to how much you can learn about a person online and secondhand. Some therapists offer a brief consultation for free, typically about 15 minutes. And it says you'll probably want to know about their past experience, expertise, their experience dealing with the kinds of issues that I'm facing or you're facing. Questions can be open-ended, as for example, can you tell me about your experience with ADHD? Basically, just ask a bunch of questions and get the answers that will make you feel comfortable. Next step here is just try at least 3 to 5 sessions, and I agree with that. It's hard to know who this person is or how well you're going to mesh with them just by going to them one time. You've got to go a few times to really get a feel for them. And if it doesn't work, it's okay to find somebody else. I know a lot of people that tend to feel that just because this person's in the medical field of some sort, mental health, let's say, that they tend to feel they have to stay with this person. And you don't. It's completely up to you. They're not supporting you in a way that you feel is beneficial, and it's completely okay to move on and find somebody else. So please do that. All right, next up, let's talk about 5 popular types of psychotherapy to treat mental illness. And this is where I found it to be very interesting because when I started to dig into the types of therapies, I had no clue that there were so many options. And I will link below a list of types of therapies because there's just so many of them. There's just a ton. But let's talk about the 5 most popular types so we can get a better understanding as to at least what those are. And then you can start doing your own search through this list that's provided. It's so great. 5 most popular types of psychotherapy that treat mental illness. So I'll just read a little bit through this. Mental health is just as important as physical health, which it absolutely is. But I'll be honest, it's hard for me to remember that, because when I call in sick due to my anxiety or mental health issue, I feel guilty. I feel guilty for calling in sick, period, but I feel more guilty when I know it's my mental health that's the problem and not some physical ailment. So anyway, according to the National Alliance on Mental Health Illness, or NAMI, 1 in 5 adults in the United States experience mental health each year. That equals to about 53 million people. Many of these people do not seek help because of the stigma surrounding mental illness. And that's true. If you're following along here, I've said many times that I've considered retiring on disability because of this mental health issue. And I'm still considering that. But one of the things that my therapist actually said to me when I was recently diagnosed with agoraphobia, that she's, I don't know if you want that on your, a lot of people just don't want that on their health records. And I was like, the more I have about my mental health on my health records, the better it would be for me with respect to disability. And so I was like, yes, I want that on there. I want all of it on there. And I don't really care what my boss and whoever else thinks about it, although she would never see it. But I have been really open with my boss about it. She's been fantastic. So anyway, seeking professional help is nothing to be ashamed of. In fact, it's one of the bravest things you can do. And I really agree with that. I do have family members who don't agree with therapy, and I really think that it could have been beneficial to them had they done that. I really do, because I think there would have been certain situations that would not have continued had they gone to therapy. But they felt it was unnecessary, which is really sad. There are many treatment options available to you if you're struggling with mental illness. And so let's talk about the 5 most popular. The first one here on the list is eye movementization reprocessing. That's a long word. In other words, it's EMDR, which I have heard of this. I have a friend who's currently going through this, and it's a really good way to help with trauma. And I'll just read what it is. EMDR is a type of psychotherapy that aims to help people process and cope with trauma. It is a relatively new form of therapy developed in the 1980s. And EMDR is an effective treatment for PTSD, which is good. I actually do have PTSD, and so this is something that I could look into. Next on this list is cognitive behavioral therapy, or CBT, which is what I just found out that I've been actually going through. Didn't know it with my therapist. But CBT is a type of talk therapy that focuses on changing negative thought patterns and behaviors. CBT is an effective treatment for conditions like anxiety, depression, eating disorders, and schizophrenia. When treating a person with this method, a therapist will help the patient replace negative thoughts with more positive ones. And that's exactly what she's been doing. Like, she's trying to get me to realize that outside my house is not scary. And by doing that, she's, okay, we're going to try and get you out a couple of times a week, or we're going to get you out of the house to go do A, B, C, and D, or things like that. And unfortunately, for me, the anxiety and depression is so overwhelming that it's hard to even do that. So I'm failing in that sense, and it's just hard to get out. When treating a person with this method, a therapist will help the patient replace negative thoughts with more positive ones. They may also teach the patient coping mechanisms and relaxation techniques to use when dealing with difficult situations or triggers. And that's true. One of the things that we had talked about recently was positively talking to myself, which I do that. So if I'm having to leave the house, I typically will sit on the edge of my bed and just talk about what I'm going to have to do that day. You're going to have to get out of the house. It's okay to get out of the house. You're going to have to do this. And just basically talk myself into it. And it doesn't always work, but sometimes it does. All right, number 3 here is exposure therapy. And that's exactly what my therapist tries to get me to do, is to put me in situations that cause anxiety so that I can work my way through that anxiety and hopefully, like we mentioned before, and close the anxiety loop. But exposure therapy is a type of cognitive behavioral therapy, or CBT, just like we talked about, that gradually exposes people to things that they are afraid of to help them overcome their fears. So phobias, PTSD, OCD, and general anxiety disorders are all examples of conditions that are treated with this method, which is exactly true. This is what we've been trying to do, and this is what I continue to fail on. So that's my fault. Interpersonal therapy, or IPT, is a type of short-term therapy that focuses on helping people improve their relationships with family, friends, and peers. IPT is an effective treatment for conditions like depression and anxiety disorder. With this method, a mental health provider helps patients identify problematic patterns and their attachment styles and teaches them how to communicate more effectively with others. This is interesting. This might be what I'm looking for. I will say this, I don't read these articles before I read them to you because I want to have a real genuine response to the articles, and maybe this is something that I need to try. Because one of the things, like I said, I want to be able to understand about myself is to identify problematic patterns. What am I doing? I didn't realize that I was avoiding things when I thought I was actually protecting myself. So finding out things like that is what I'm really interested in knowing. They also may provide guidance on how to resolve conflict with relationships and how to maintain healthy relationships going forward. Very interesting indeed. The last one here is dialectical, hope that's how you say that, behavior therapy, or DBT. This is actually one of the things that my psychiatrist recommended, along with CBT. But dialectical behavior therapy is a type of cognitive behavioral therapy that researchers develop for treating borderline personality disorder. I don't have that. However, today it's used to treat disorders like bulimia, anxiety, and depression. Okay, I do have that. Not bulimia, but the other. This method will teach patients skills to help them regulate their thoughts and emotions, such as mindfulness meditation, which I know how great that is, but I tend to I can't sit there and my mind is always racing, and I have a hard time just sitting there and thinking. That makes sense. Distress tolerance, managing emotions during stressful situations without reacting with harmful behavior. I understand that. Emotional regulation, understanding and being more aware of emotions. Interpersonal effectiveness, learning how to ask for what you need and setting boundaries with others. Very interesting. So I hope you found that interesting. Those are the top 5 most popular psychotherapies. So let's go into ones that may not be as well known. This is called Mindfulness-Based Cognitive Therapy, or MBCT. Is a modified form of cognitive therapy that incorporates mindfulness practices that include present moment awareness, meditation, and breathing exercises. I think breathing exercises are so important. I don't do it often enough. And I'm sure that there are times where I probably should have done it and I just don't. But I also know how well it works. This therapy was formulated to address depression. Using these tools, the mindfulness-based therapist teaches a client to be in the here and now, as well as break away from negative thought patterns that can cause a decline into a mood disorder state. The therapy can help a person fight off a difficult frame of mind before it takes hold. So what's it used for? General anxiety disorder, bipolar disorder, general emotional distress, addictions. MBCT has also been shown to improve symptoms of depression in some people with physical health conditions, vascular disease, traumatic brain injury, and chronic pain. And here it gives you what to expect. MBCT is normally conducted within a group setting, and the weekly sessions are led by a therapist. In about 8 meetings, you will learn meditation techniques as well as basic principles of cognition, such as the relationship between the way you think and how you feel. This sounds very interesting. You'll also have the opportunity to learn more about your depressive condition on the days that there is no session. There is homework, which would include practicing breathing exercise and mindful meditation. That's where I would fail because I am not good at doing the homework. You'll also be encouraged to bring a present moment awareness into your everyday routine when you prepare a meal, as you eat, and while you shower, and when you are walking. Interesting. How it works. For a person who has recovered from a depressive state, sometimes normal sadness is a powerful trigger for a relapse into depression. Rather than trying to avoid or eliminate sadness or negative emotions, one learns to change the relationship with these emotions. Accepting sadness, for example, can be executed by practicing meditation and other mindfulness exercises. These activities rebalance neural networks, allowing the client to move away from the automatic negative response toward the understanding that there are other ways to respond in difficult situations. In fact, you will learn that you are not your thought patterns. What to look for in mindfulness therapy is how they may help you with particular concerns, if they have ever dealt with that type of problem before, what their process entails, and the timeline of treatment. That's really interesting. See, this is why I don't read it until I actually see it, because I find it to be so interesting. All right, next up on the list here, I say they're unknown. They may not be unknown to you, but they're unknown to me. But the next here on the list is compassion-focused therapy, or CFT. It's a therapeutic approach that aims to help those who struggle with shame and self-criticism. Oh, that would be me. Often resulting in early experiences of abuse or neglect, which I didn't have that. But CFT teaches clients to cultivate the skills of self-compassion and other-oriented compassion, which are thought to help regulate mood and lead the feelings of safety, self-acceptance, and comfort. This technique is similar to the mindfulness-based therapy in that it also instructs clients about the science behind the mind-body connection and how to practice mind and body awareness. CFT is a relatively new modality developed in British psychologist Paul Gilbert in the first decade of the 21st century. Some small studies and research reviews suggest that it can be effective for the treatment of mood disorders and anxiety. It can also help people who are especially prone to self-criticism manage their behaviors. That is me. I just don't have a good thing to say about myself. Some researchers have also begun to teach whether it can be beneficial to people with eating disorders or symptoms of psychosis, with some positive results so far. When is it used? CFT can be used to help manage many long-term emotional problems related to persistent shame, self-criticism, and inability to view oneself or one's behavior kindly and compassionately. Potential clinical issues that can be helped by CFT is anxiety disorder, mood disorders, personality disorders, eating disorders, hoarding disorders, and psychosis, as well as anger issues, poor body image, and relationship challenges. Ooh, that is describing me into a T. Not all of it, but I definitely have body images. Definitely have relationship challenges. No hoarding. I say eating disorder in a sense of I self-soothe with food. Not really necessarily binging and purging. It has been used to help treat children, teens, and adults, and can be practiced in individual or group settings. So, what to expect? CFT treatment works towards the overarching goal of cultivating compassion for the self and others. To that end, the therapist will often start by teaching the client about the evaluation of their brain, the construction of the self, and the systems that regulate emotions, as Gilbert theorizes that disruptions in the brain emotion regulation systems lead someone to hyperfocus on threat while disregarding the need to self-soothe. Ooh. Yes. I do that. I definitely do that. I have such a negative mind about everything. This type of therapy might be helpful to me. See, this is why I don't read it until I read it with you guys. How awesome is that? Anyway, the therapist then will help the client develop the key skills of compassion, self-compassion, and mindfulness via a technique known as compassionate mind training, or CMT. CMT is comprised of guided exercise, including role-playing, visualization, meditation, and activities intended to foster appreciation of daily life that aim to help the client recognize what compassion feels like and become better at practicing it. How it works. CFT postulates that humans have at least 3 different emotion regulation systems: a threat, self-protection, which generates anger, disgust, and fear to protect us; a drive and excitement system, which motivates us to seek outside resources like mates, food, and status; and soothing and social safety system, which is activated when we feel peaceful and content enough that we are no longer compelled to seek outside resources. Imbalances between these systems can result in mental illness and or maladaptive thought processes and behavior, CFT theorizes. People high in shame and self-criticism may not have had enough stimulation of their soothing system early in life and too much stimulation of the threat system. Oof, I'd say that's for sure. For me. As a result, they can struggle to be kind to themselves and to feel kindness for others. They may be highly sensitive in criticism or rejection. Yes, very much. Whether real or perceived, mine's usually perceived, I think. And internalize that disapproval. The goal of CFT is to correct this imbalance in emotion regulation systems. All right, next here on the list is dance therapy. And I put this on here because I have a friend of mine who really enjoys going out and doing dancing. And I like to dance. I'm not good at it, but if you get me in a club or a bar, I like to dance, but I don't know how to professionally dance. But dance therapy is sometimes referred to as dance movement therapy, or DMT. It's a mental health treatment that uses dance and other forms of physical movement to improve someone's emotion and psychological functioning. And I chose this because of my friend, but I actually did recently sign up for Pilates, and my first class is on Wednesday, which I'm not quite sure if I'm going to make it because I'm still sick. And part of being sick right now is that I feel really tired. And so I don't know if going to Pilates is the right thing for me. But nonetheless, I've signed up. It may or may not be Wednesday that I go. But that was the whole point, was to get me out of the house, to be immersive into the world that makes me scared. So anyway, a mental health treatment that uses dance and other forms of physical movement to improve someone's emotional and psychological functioning. Dance therapy has been used to treat a wide variety of mental health disorders, including depression, eating disorders, and PTSD, as long as a non-clinical issue such as low self-esteem, body image concerns, or grief. Because dance is a form of exercise, the therapy may also result in physical benefits such as improvement of sleep, increased energy. When is it used? Dance therapy can be conducted individually or in a group setting. It can be used to treat children, adolescents, adults, and the elderly. Dance therapy can be utilized for a wide variety of conditions and challenges, including anxiety, autism, dementia, depression, interpersonal issues such as family, conflict, and low self-esteem, and much more. While it can be used on its own, dance therapy is often used as a complement to more traditional therapies. Experts caution that certain conditions such as eating disorders should never be treated with dance therapy alone. Which that makes sense. I understand that. What to expect? Dance therapy sessions often start with a warm-up or verbal check-in, or both. Therapist and client may decide on a theme to explore that session based either on the client's needs or on the program designed by the therapist. During the session itself, the therapist will guide the client through dance or other forms of movement that aim to express their internal emotional state. Clients are often encouraged to free associate. In some cases, they may be asked to create specific visual metaphors to represent or an internal challenge. Therapists may move with the client or simply observe. Some therapists engage in what also known as mirroring or matching the client's movement in order to illustrate empathy and validate the client's self-expression. What to look for in a dance therapist? It says the U.S. dance therapists are overseen by the organization known as American Dance Therapy Association, or ADTA, which was founded in 1966, and according to the ADTA guidelines, dance therapists should have at least a master's degree. Very interesting indeed. All right, next here is social recovery therapist. Social recovery therapy is a cognitive behavioral intervention designed to help restore a more capable mental state to young people with first episode or longer term psychosis by improving social and vocational skills and encouraging more particular participation in social activities. Oh yes, I need this. The goal. I think I need all kinds of therapy. As I keep reading this, I'm like, yeah, this will be helpful. The goal of this is to help people, especially those in early stages of psychosis, increase the amount of time they spend actively involved in social settings to thrive in their community, rather than merely survive as outsiders, thereby preventing long-term disability and or development of schizophrenia or other related psychiatric disorders. Okay, I don't have that. My thing is, I think I have some type of social disorder. I've not been diagnosed with it, but just based on what I do, it makes me think that I do have some kind of social anxiety or something. SRT is a relatively new modality with preliminary evidence for its efficacy, first published in the late 2000s. So far, research has shown that some positive effects, especially immediately post-treatment. One 2017 study, for example, found that patients who underwent SRT spent significantly more time engaging in work and other meaningful activities than a control group did. When is it used? Social recovery-oriented cognitive behavioral therapy is typically used to identify and address the needs of adolescents and young adults in the early stages of psychosis, many of whom have multifaceted comorbidities. It is also often used in older teens and adults in their 20s and 30s who struggle with social disability, isolation, withdrawal, difficulty communicating, and or demonstrating a reluctance to engage in structured activity and seek support during or after an episode of psychosis. What to expect? Social recovery therapy rests in large part of therapy relationships that are supportive, hopeful, and flexible. Once a baseline level of trust is established, patient and therapist work closely together to identify challenges and obstacles to social functioning, establish social goals and expectations, and match those goals to relevant agencies and activities. This could include referrals for vocational counselors, participation in educational groups, and seeking out and joining community centers that host sports and other social activities. Successfully engaging in these activities and navigating problems as they arise can help patients develop a sense of agency and promote optimism and other ability to function in the world. How it works? Psychosis is a broad term describing some loss of contact with reality. It can have various causes. It is often associated with schizophrenia and a serious mental disorder that can have lasting negative consequences. Despite recent advances in treatment, full recovery from schizophrenia remains difficult for many to attain. While many patients do receive early intervention services, which in some cases can promote significant gains, some struggles to adhere to the conventional interventions. What to look for in a therapist is available. Try to find one in your area. interested in patients and their families should look into licensed mental health professionals with specialized training for cognitive behavioral therapy, knowledge and social recovery interventions, and experience working with younger people. That's really interesting. Don't know anything about that. And the very last one here that I chose, which don't worry, there's a whole long list of things that you can look at, but this one in particular is positive psychology and wanting to find out more about what that is. All right, positive psychology. Unlike traditional psychology that focused more on the causes and symptoms of mental illness and emotional disturbances, positive psychology emphasizes traits, thoughts, patterns, behaviors, and experiences that are forward-looking and can help improve the quality of a person's day-to-day life. These may include optimism, spirituality, hopefulness, gratitude, happiness, creativity, and perseverance, justice, meaning, and purpose, as well as the practice of free will. When is it used? Positive psychology can be applied to all age groups, from children to adults in educational settings and mental health facilities, as well as in private counseling practices. There is also a place for positive psychology outside the area of therapeutic practice, such as human resource management and business administration. Positivity is good for all types of institutions, companies, and organizations because it increases the chances of success and it is contagious. This makes sense because other people matter in positive psychology. What to expect? Positive psychology is sometimes referred to as the science of happiness. One of the questions positive psychologists try to address is, can a person be happy and realistic at the same time? That's one of the struggles that I have. I tend to be so negative with my thinking that it can be hard for a realistic person as myself to have a positive outlook. Because I'm too much of a realist. While acknowledging the problems of the world as well as that of the individual, positive psychologists believes one can still lead a productive, meaningful, satisfying life. The goal is to minimize negativity in one's thinking and behavior and develop a more optimistic and open attitude that will enhance rather than disrupt one's social, professional, and spiritual life. How it works. To a large degree, a positive psychology movement back in the 1950s and 60s with the introduction of humanistic approach therapy. Soon after, psychologists began to realize looking only at the damage already done to adults was not helping to prevent mental health problems that often began in the childhood. In the late 1990s, or as the kids say, in the late 1900s, psychologists recognized that for the sake of prevention, researchers and practitioners had to start looking more closely at human strengths and virtues, not just the weaknesses, and figure out how to instill positive traits into young people who may be at risk for developing unhealthy emotions. They came up with the PERMA model. So that's PERMA, P-E-R-M-A model, with the P standing for positive emotions. The pursuit of positive emotions will not necessarily improve your well-being. However, the experience of positive emotions through savoring your day-to-day moments may well boost your well-being. E is for engagement. Being engaged with life is important for well-being. Otherwise, your mind and body will run on automatic and you may suffer tedium and little meaning. R is for relationship, positive relationships. We thrive when we are connected in meaningful relationships. M is for meaning. A sense of meaning and purpose is essential to well-being, and I totally agree with that. I think that's one of the struggles that I have at work. If I am working on a job that is absolutely has no meaning to me whatsoever, it's just kind of busy work, and I feel like I'm not making much of a difference, then I don't have a sense of purpose with the position. And I tend to, for lack of a better word, slack off. I just don't put in as much effort because I just don't find that the position has purpose. Which is terrible because every position and everything that I've been doing should I should approach it in the same way. Anyway, the last here is A is for accomplishment and achievement. We each need to succeed and accomplish the goals we set. This quest for self-improvement is essential. What to look for in a therapist is you might ask a prospective therapist these questions. How often have you dealt with problems such as mine? How do you know whether my situation is a good candidate for positive psychology? How do you use positive psychology in your practice? What is the typical plan of treatment? And how long is a typical course of therapy? And how do you measure progress? Very interesting. Very interesting. Okay, last thing here on our list to talk about is things to discuss with your therapist. So say you've gone through all the steps, you've figured out who you want to use as your therapist or what type of therapy, and then now let's talk about how you move forward with talking with this therapist. So this is an article that says 15 things to talk about in therapy. So one thing I said before is you have to be open and honest. Things are not going to work or be beneficial to you if you are not honest about what it is that has caused the mental illness or mental health issue. Okay, the first thing here on the list, it says your present feelings and emotions. Name specific emotions that you felt this week, anxiety, joy, etc. Explore the physical sensations that accompany these emotions in your body. Discuss the situations or triggers that brought you to these strong feelings, and identify any emotions that you find difficult to express or understand. One of the things that my therapist at one point asked me about my story, if you will, she basically said, what led up to my anxiety? What steps led up to the anxiety? And I went through the story with her, and it was eye-opening to hear. I always knew the story, but when I explained it to her, I started to realize why things happened the way they did. So it was real interesting to go through that. So number 2 here is your relationships and interpersonal issues. So this is another topic here to talk to your therapist about. So describe communication patterns with your family. Talk about specific conflict or misunderstandings, explore feelings of loneliness, and discuss your expectations and boundaries in your most important relationships. Recurring patterns and behaviors. Identify recurring reactions to stress or conflict. For me, that's anxiety. Discuss habits you want to change. Explore any self-sabotaging behaviors you've once noticed in your career or personal life. Yeah, I have some of those for sure. Note any repeated themes in your thoughts and worries and dreams. Alright, next here on the list is your self-esteem and self-image. Talk about your inner critic. Well, I have such a huge inner critic. I think most people do, but I know for sure I do. And then the content of your negative self-talk. Explore how you perceive your body and overall appearance, which for me, I feel ugly. And that's part of the reason why I don't want to maybe go outside, because I just feel ugly. Like I'm overweight. I gained probably close to 100 pounds since this whole thing started with anxiety 6 years ago. And I feel ugly. And yeah, ew, that's all I can really say. Anyway, so explore how you perceive your body and overall appearance. Discuss your perceived strengths, weaknesses, and sense of self-worth. Identify past experiences that may have shaped your self-image. Okay, next here on the list is past experiences and traumas. Trauma and past experiences often linger in the background of our lives. Therapy allows us to process these memories at your own pace. You are always in control, and a skilled therapist will guide you with care and sensitivity. EMDR is one approach to help you safely reprocess traumatic memories. Share memories or experiences that still impact you today at your own pace. Discuss past events might affect your current fears, triggers, and behaviors. Explore feelings of guilt, shame, or anger, and remember that you are in control, and a good therapist will not force you to discuss anything you're not ready to discuss. Next here is life challenges and transitions. Life transitions like starting a new job, moving, or entering a new relationship can bring both excitement and stress. Therapy helps you navigate these changes, process your emotions, and build resilience for the future. Talk about the stress of a new job, a recent move, or change in relationship status. Explore feelings of uncertainty, excitement, and grief about the future. Discuss the challenges of major life events like marriage, parenting, and illness or loss. Next here is your coping mechanism. Coping mechanisms are the tools we use to manage stress. Some are often helpful, others less so. Therapy helps you evaluate your current strategies and develop healthier ways to cope with life challenges. Identify your go-to strategies for dealing with stress, both healthy and unhealthy. Discuss unhealthy coping mechanisms you'd like to change, for example, substance use or overeating. Explore where and when you learn these coping skills and brainstorm new, healthier strategies with your therapist. Thoughts and conflicts you tend to avoid. Avoidance, this is me here. Avoidance is often a sign of deeper emotional conflict. Therapy is a judgment-free space where you can explore difficult thoughts, fears, and decisions. Naming what feels scary is a powerful step toward healing. Mention a topic that feels off limits or scary to bring up. Talk about your fears of judgment from others or even yourself. Explore internal conflicts or difficult decisions you're struggling to make. Acknowledge things you feel guilty or ashamed about in a non-judgmental space. Number 9 here is the small issues that bother you. Even small irritations can reveal important emotional patterns. Therapy helps you unpack why a minor event triggers a strong reaction. Often insight into your deeper beliefs and needs. Describe a minor annoyance from your week that has stuck with you. Understand the small issues often point to a larger underlying pattern or beliefs. Explore why a seemingly insignificant event caused a strong emotional reaction. And use minor issues like low stakes starting point when you don't know what else to say. 3 things to talk about in your first therapy session. Your personal history and background. Give a brief overview of your family dynamics and upbringing. Mention any significant life events, milestones, or previous experiences with therapy. Share your educational or career paths. You don't need to tell your whole life story, just provide the context for what brought you to that therapy session. Number 2 here is your goal for therapy. Answer the core question as to what brought you to therapy. Describe what you hope to achieve and change or understand through the process. Mention specific outcomes that you'd like to see in your life and discuss your expectations of the therapist and the therapeutic relationship. Next here on the list is your current challenges and stressors. Describe the primary issues, symptoms, or feelings causing you distress. Talk about the main source of stress in your life right now, whether it be work, family, or health. Explain how these challenges are impacting your daily life and mood and relationships. And share what you've already tried to do to solve the problem on your own. Alright, the next section here and the last one is, what if I feel like I have nothing to talk about in therapy? And I know a lot of people do have trouble with this because they tend to have trouble talking about themselves. But you really have to be open and honest. So, what if you feel like you have nothing to say? Feel if being stuckness is a valid and important therapeutic topic in itself. So you can talk about what that you don't have anything to say. Could lead to more, deeper conversation. It can sometimes reveal a subconscious resistance or avoidance of a deeper issue. That's what I just said, kind of. Your therapist can help you explore what this blankness might mean in a curious way. Being honest about it builds trust and authenticity in the session. Discomfort or trouble opening up. Express any feelings of nervousness, awkwardness, or fear of judgment in the therapy room. Talk about the general difficulty of being vulnerable. Explore if the silence is related to the therapeutic relationship itself. Ask your therapist directly for guidance. I'm not sure where to start today. Can you help? And the last one here is a review of your progress and setbacks. Reflect on what has changed for you since you started therapy. Discuss specific strategies, insights, or aha moments that may have been helpful. And identify any recent setbacks, recurring challenges, or times you fell back into old patterns. Revisit your initial therapy goals to see if they are still relevant or need to be updated. And that is it, folks. I really want to thank you for joining me today. This has been a very, very interesting topic to explore, and I'm happy that you're here to explore with me. I hope this was beneficial if you are out there searching for a therapist, that you may at least have now some kind of idea on how to approach this topic. I know there were a lot of things that I went through or thought of when I was reading a lot of this, was that there's all kinds of therapy out there that I could take. So anyway, I hope you have a wonderful week, and I will see you on Wednesday for our check-in Wednesday. We'll talk to you then. Bye-bye. If today's episode of Real Stories, Real Struggles, and Real Hope resonated with you, please like, comment, and subscribe. Your engagement helps others find this space and feel less alone.